Welcome back to Shape of the City. I'm Clover Frederick, your host. Since 2011, the R.E.A.L program has provided mental health services and resources to citizens of Lincoln and Lancaster County. So what does this program really do? To learn more, I'll talk with Chad Magdanz from the Mental Health Association of Nebraska and Sergeant John Walsh and Officer Melissa Ripley from the Lincoln Police Department. Thank you all for joining me today.
Thank you for having us.
Yeah. Let's start with Chad. Now tell me, R.E.A.L is an acronym, correct?
It is.
Now why don't you tell me what that stands for and then tell me a little bit about the program.
It actually came from a participant when we were changing the name about a year ago, and it stands for Respond, Empower, Advocate, and Listen.
Great.
R.E.A.L.
Great. So tell me what the program does.
Well, what we do is we get referrals from law enforcement officers and other organizations in Lincoln for folks who may not be doing so hot, having some mental health problems, but aren't necessarily breaking the law, doing anything illegal, but need some extra care. What happens is we get a referral from the law enforcement officer who has already met the person and been on the call, and they give us a referral, and we go out there and meet them, see what's going on.
Great. How important is this program to our community?
It is a really important program for the community. It's a program that is proactive and it is a quality of life measure that helps people out. It's also a financially responsible way to treat people, get them help they need before the crisis happens.
Very good. Now, what organizations or government agencies are involved in the R.E.A.L program?
It started out with the Mental Health Association of Nebraska, Region 5 systems. And then it was with the police department originally. 6 months ago, we started also working with Nebraska Corrections, with folks coming out of the penitentiary, York, Tecumseh, places like that. Same ideas, getting people the resources that they might not necessarily know about, getting them plugged in with things, people to talk about, people who've possibly experienced the same things they have. Okay,
very good. Now, what has the success been for this program?
More than expected by a long shot. Since it started in 2011, we've had almost 1,200 referrals. We've had almost 300 officers use the program. It's a voluntary program on their side too. They're not required to use it. They recognize it as a tool. We get in touch with about 60% of the people we have been given referrals to. And out of those 60%, about 85% accept services. So that's a number of about 600 people who are getting services and are plugged in now that weren't.
Great, very good. Do you have any specific stories you can share?
One that I really like, and one that was very challenging to say the least, was we got a referral for a gentleman who had problems with a car wreck, an undiagnosed TBI, but also the drink problem. Had drank a lot for a long time. He was in very poor condition, infested with bed bugs in his apartment, not really knowing where to go, family not knowing where to go. When we were referred to him, we helped him with all of those things. We do things in a level, you know. Of course, we need to get rid of the bed bugs before anything can happen. We did that. We helped him get into doctor appointments, physicals, was there when he needed to talk, when he felt like drinking again, helped him with support groups, helped him and assisted him to get into Valley Hope and O'Neill. And he's working today, and he is doing what he needs to do in a clean apartment and doing and utilizing the services of his choice. So.
Very good.
Yeah.
Thank you.
And that happens a lot, things like that. So,
yeah, great. Now, Officer Ripley, why don't you explain what Lincoln Police Department's role is with this program?
Our role is basically to make the referrals, and what that looks like is if we are to go out on a call for service where someone may not meet the criteria to be placed in emergency protective custody, maybe they're on the verge of a crisis or aren't necessarily in immediate danger to themselves, but still need some kind of services or some advocacy or would benefit from receiving assistance in getting resources throughout the community. We make a referral, which is just a simple email to the R.E.A.L program, and we know within 24 hours that person will be contacted by one of the peers that work with the R.E.A.L program. And the nice thing about that is that we may not have time as a police officer to walk them through the system and be able to show them all the resources that Lincoln has to offer them, but we know that someone will be in contact with them and they will hopefully get the help that they need in the end. It's one of the best resources that we have as police officers, really. So.
Thank you. Now, Sergeant Walsh, I know that you've seen some successes with this program.
Yes.
Tell me more.
A couple years ago, we did a study and we compared some of those folks who had accepted services from the R.E.A.L program and some who hadn't. And we found that over a course of time, that being about 6 months, they were less likely to be seen and evaluated on a mental health call for service. And also they were 16 to 22% less likely to be arrested. So it's affecting kind of all facets of their lives at this point. It's real important for us when we have kind of constant run-ins with people to maybe determine what's going on in their life and if this is something that we can help them out with and make that referral to. It's not only beneficial to them, but it's beneficial to their neighbors and then to the police officers as well.
Okay. Now, what would you tell other police forces about this program as far as how they can help their community?
Well, I would mirror what Officer Ripley said. This is invaluable to us. There's a lot of really hard problems and cases that I've personally sent them that they've worked with. I know of others that they've talked with, and these are folks that normally we probably wouldn't have had much to do with other than here's a sheet of places you can call. It's up to you to do that. Sometimes we do direct handoffs. When the situation's bad enough, they'll come out and help. It's right. It's what we got into this job to do, is help other people. A lot of times I can't do that and Melissa can't do that, but when we put them in Chad and his staff's hands, we know they're going to be safe. We know there's going to be a good outcome. But again, it's up to that person, and we're giving them every shot to succeed.
That's great.
Yep.
Now, Chad, what does the future of the R.E.A.L program look like?
Well, we've worked with the Community Health Endowment since the beginning of this. They've helped us with data to prove that what we're doing works, as John was talking about. And we're just going to be talking with the county in the weeks to come and talk about financing and making it a permanent program. And it is proven itself successfully, and it's a good way to treat people.
Very good. Now, if somebody in the general public would like to learn more, how can they learn more about the program?
We have a very simple website, www.mha-ne.org, or our office phone number you can call. I'm going to look at that quick. It's 402-441-4371. Call, someone will be there, or leave a message. So.
Great. Well, thank you for all the work you're doing here for our community. We appreciate it. Thanks for being here.
Thank you.
Thanks, Clover.
Mm-hmm. Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com.